I'm Dr. Irv Cohen, and I'd like to talk to you about whether or not diabetes can be reversed naturally. My specialty is a field called preventive medicine, which is a specialized field of medical practice. And what makes it different is that I was trained to look at earlier stages of disease to prevent things from going to the end stages where we have to deal with failed kidneys and heart disease and that sort of thing. And that becomes very important in talking about diabetes. Now, specifically, I'm talking about type 2 diabetes as being reversible. Type 1 diabetes, unfortunately, is an event that usually begins suddenly when our body is not able to produce its insulin. And because there's usually damage to the pancreas, that means that it cannot be reversed. Type 2 diabetes, on the other hand, which is what most people are suffering from today, is a gradual progressive disease. It's a complex sequence of events, and it's possible to intervene at everywhere but the very, very last stages to reverse it, and often to reverse the damage that's been done to other organs. Now, we consider type 2 diabetics to be overweight because there is a relationship between weight and diabetes, but let's make it clear there are a significant number of people out there who are not overweight and yet are still type 2 diabetics. And the reason for that is that these were still being caused by dietary issues, but the people didn't gain the same amount of weight. In fact, we have understood those dietary issues going back to ancient India. Why India? Well, it turns out they were the first nation on earth, or the first area on earth, to learn how to extract and refine pure sugar. And because of that, they noticed a epidemic of both overweight and diabetes way back when. It even is in their legends. But for most people, the progression starts very innocently. If you take in too much energy, then what do you have? Normally, you'll have an exaggerated sugar level. Your body responds to that high sugar level by producing more insulin. That's perfectly normal because insulin does two important things. It takes the sugar and it tells your cells to use that sugar for energy. But then it takes the excess blood sugar and it takes it and converts it to a form of energy that can be stored. Often that's in the form of fat. It's also sometimes in the form of a starch called glycogen. But that's the correct role for insulin. But what happens when we do this continuously is that our cells become resistant to that insulin. Once our cells become resistant to that insulin, the sugar level starts to creep up again. Well, what happens? We then have to produce even more insulin in order to bring the sugar level down. And of course, that can create even more insulin resistance. Eventually, our pancreas, that's the organ in our body where we create that insulin, can't do its job and produce enough insulin. And that's the point in diabetes where you have to take medications that increase insulin levels or take insulin itself. And that's when type 2 diabetes starts to look very much like type 1 diabetes. And without some sort of intervention, you would have a constant high sugar level. Now you can see the loop that occurs because if you develop insulin resistance and you have a higher sugar level, you produce more insulin, and then you develop more resistance to the higher level. So this becomes a vicious loop, making diabetes worse and worse. But what happens when we treat it? Well, up until the 1920s, the only treatment that doctors understood was dietary. In the 1920s, with the discovery of insulin, it was possible to take the worst diabetics and to supplement their insulin through injection. Beginning about 30 years ago, we started to see more and more use of oral medications. But there's a trap in that. And the trap is even worse with oral medications, because what happens? Let's look at the loop that we're showing on this slide here. If you have a high sugar level, you're likely to be prescribed more medication. That will give you a higher insulin level and help lower your blood sugar. But what happens then? Well, that arrow goes off in two directions. But let's look at where it goes down. Anyone who is on medication for diabetes knows about hypoglycemic episodes, where perhaps they've eaten less that day, or perhaps they've exercised more and done something strenuous and the blood sugar gets too low. Well, if your blood sugar gets too low, what's the most likely thing that's going to happen? You're going to be told you have to eat more. But wait a second, what happens when you eat more? Your sugar level goes up, and now you're given more medication. So this becomes a vicious cycle. The other thing that happens, since by raising the insulin level, we're telling your body to store more fat, is many people, when they're started on medication for diabetes, particularly if they're started on insulin injections, will start gaining even more weight. So you can see the trap in the cycles if we don't intervene. And then we hear about all the effects of diabetes, whether we're talking heart disease, kidney disease, eye disease. We're looking at the higher sugar levels. So if we can intervene, break the cycles, we also have to be bringing those sugar levels down. Well, can we do this? Let's look at the starting event. The starting event is excess energy. If we can intervene at the excess energy level, then all the things that happen in sequence can be better controlled. Is there a point that we can't use that simple intervention? Yeah, there is. If your pancreas is just burned out, where your type 2 diabetes is starting to look like type 1 diabetes, then the dietary approach by itself may not work. But the majority of people, including many type 2 diabetics who've been taking insulin for years, may still have enough pancreatic function that they can successfully be able to reduce or eliminate their need for medication. In order to do this, we have to be very positive about it. You have to start early enough. You can't wait until you're into long-term damage. And you have to be motivated, because this is not something you can do 3 days a week or 5 days a week. It has to be done 7 days a week. So you need to have consistency. But for those of you who hate testing, the bad news is that it's not going to work if you don't monitor it. So you must be willing to consider testing. And if you are on medication, you absolutely must be working with your physician. This is not a do-it-yourself proposition, because you have to reduce or eliminate your medication when you make a major dietary change. So if you're willing to do those things and able to do those things, you stand a very good chance of being able to successfully reverse your diabetes. If you want to learn more about this, my book is Diabetes Recovery Using the New Hippocratic Diet. It's available either through our website or through any of the online website or any bookstore can order it if they don't have it on their shelves. We accompany that with our cookbook, which has lots of healthy recipes for you. And the good news is that there's now an online course that will take you about 8 hours to complete. Most people can do it in about a week, doing it in multiple sessions. And you can reach that course through www.learntodiet.com. That's the number 2, learn2diet.com. So I hope that this has given you an idea that there are alternatives to a lifetime of continually increasing medication and continually worsening control. I suggest you look into it, and I wish you the best in achieving better health through the right type of diet.